Obamacare proved itself to be problematic in 2013, and experts say 2014 may not be much better. Some key Obamacare dates this year could spell trouble for your health care and your wallet. The author of Beating Obamacare, Betsy McCoy, joins us now. Good morning. Happy New Year, Betsy.
Yeah, Happy New Year to you.
So January 1st.
So happy.
You're right. January 1st, the mandate kicks in. What does that mean for most Americans?
Okay, this law says that beginning today, legal residents of the United States must have what the government defines as adequate health care coverage. So if you're not in Medicare, that's for seniors. If you're not in Medicaid, that's for the poor. If you're not on TRICARE for veterans, then either your employer has to provide adequate coverage or you have to go out and buy it yourself. And that's why many people are being told they have to go to these Obamacare exchanges and sign up for health care. But here's the irony. Today, millions more people are uninsured than yesterday.
Right.
Because of this law. On one side of the ledger, 6 million cancellations so far. You've heard about them. And many more people who have what are called mini-med plans at work, those are going to be illegal now, too.
Right.
On the other side of the ledger, 800,000 have signed up for Medicaid, they're covered, and 2 million supposedly have enrolled in private health plans on the exchanges.
Right.
But some of those people, maybe half or more, haven't actually paid their premium.
Right. So everybody today needs to check to see if they're actually enrolled. Now, the other important date, March 31st. Why is that important?
Well, that's the end of what's called open enrollment.
What does that mean?
Open enrollment means you can sign up for health care, but there are many exceptions. If you change your address, if you change your family size, if you change your job, if you change your income, there are many reasons that you can sign up for Obamacare after the open enrollment period.
That's good to know. So
Not
the
a big
spring
deal.
is also another deadline. Now, November 15th. Now, this other key date used to be in October, but they moved it. Now, why did they move that?
Tricky. Well, most political pundits say they moved it to avoid the midterm elections. Don't forget, there are big elections this November for the United States Senate, for the United States House of Representatives, and Democrats are so afraid that people will see how much higher premiums are next year. They're already up 41% this year compared with last year.
So they don't want people going to the polls already seeing the premiums jacked up and then taking it out on the Democrats.
So they wanted to delay the open enrollment period next year till after the election. Pretty cagey.
Right. Now, well, it's political. So December 31st, the final key date this year.
That's not going to be happy news because it's widely expected that even more millions of people will be uninsured than right now. And here's why. Employers are likely to do exactly what they did last year. Anticipating the employer mandate, which now kicks in 2015, employers are going to start pushing their workers down to part-time status, to avoid the mandate. They're going to look at the cost of these new requirements for health insurance, the government design plan, which adds $1.79 an hour to the cost of an employee.
Right. So next year could be even more tragic for a lot of
maybe
Americans
another 20 million according to some people.
Betsy, thank you very much. Happy New Year. Everybody read your book. All right, coming up, should a drug test be required for people who want welfare? A judge just issuing a huge ruling on this one, and you won't believe this decision. And if you think counting calories will help you lose weight in the new year, think again. Up next, the other calorie myths.